Hi, I'm Magdy Nawar. I'm a gynecology consultant at the Clementine Churchill Hospital in Harrow. Today, I'll be sharing my expert knowledge about uterine fibroids and getting help for this common gynecological condition. Let's begin. What are uterine fibroids? Firstly, fibroids are small growths that develop in or around your womb. In the majority of cases, they are non-cancerous, otherwise known as benign. The fibroids attach themselves to the wall of your womb and may vary in size from a few millimeters to several centimeters. There are several types of fibroids, which is determined by their location in your womb. There are three main types of fibroids. The first are intramural, which grow within the muscle wall of your womb. The second are subserosal, which develop on the outer side of your womb and can grow into the pelvis. Finally, there are submucosal fibroids. These can bulge and grow into the cavity of your womb. Sometimes the fibroids may have a narrow stalk of tissue that attaches them to your womb. These are called pedunculated fibroids. What causes fibroids? It's not known what causes fibroids, but studies suggest genetic predisposition and prolonged exposure to the hormone estrogen may increase your risk of developing them. Fibroids tend to develop when your estrogen levels are at their highest, which is usually during a woman's reproductive years, generally from around 20 to 50 years of age. Estrogen is the female reproductive hormone and it's produced by the ovaries. When the estrogen levels are low, fibroids tend to shrink. This typically occurs after the menopause, when the menstrual cycle stops. As such, age is a common contributing factor. Other factors that put you in a higher risk of developing fibroids including family history and being overweight. What are the most common symptoms of fibroids? Most women who develop fibroids are unaware that they have them. This is because in most cases the fibroids do not produce any symptoms. However, around 1 in 3 may experience some of the following symptoms: painful or exceptionally heavy periods leading to anemia, pain or swelling in the lower abdomen, the need to use the toilet frequently, discomfort or pain during intercourse. Sometimes difficulty to conceive is also a presenting symptom. How do you diagnose fibroids? The majority of fibroids are picked up during a gynecological ultrasound scan. This can be arranged if you have symptoms which may suggest fibroids. If the fibroids are large, it may be possible to pick these up on gynecological examination. Occasionally, an MRI can also be used to identify the number, size, and location of fibroids. This can be arranged if the ultrasound has failed to do so adequately. A hysteroscopy involves inserting a small telescope through the vagina and cervix to look inside the womb. This may sometimes be used to assess if there are any submucosal fibroids. What are the treatment options? This depends on the symptoms, number, size, and location of the fibroids. It also depends on your age and fertility wishes. In most cases where fibroids do not cause any symptoms, there is no need for treatment. If you are experiencing any symptoms caused by fibroids, medication may be the first course of action. As well as helping to relieve the symptoms, some medication can also help shrink the fibroid. Sometimes oral medication may be given to reduce heavy bleeding and to help reduce the size of fibroids in women with moderate to severe symptoms. GnRH analogues are injections that can be used to shrink fibroids, and this is usually given prior to surgery. What is surgery for uterine fibroids like? There are several different surgical procedures available to treat fibroids. This is considered if medical options fail or if the fibroids are particularly large, therefore are unlikely to respond to medical treatment. You can have a hysteroscopic resection of fibroids. During this procedure, a thin telescope called the hysteroscope, which is fitted with small surgical instruments, is used to remove the fibroids from the inside of your womb. Because the hysteroscope is inserted through the vagina and cervix, it requires no incisions in the abdomen. This only treats submucosal fibroids, which are the type that bulge into the lining of the womb. Myomectomy is a surgical procedure where the fibroids are removed from the wall of the womb. This can be an open surgery, which may be needed if the fibroids are numerous or large. Some can even be done by keyhole surgery, also known as laparoscopy, but not all types of fibroids are suitable for this procedure. A hysterectomy is an alternative to a myomectomy. In this procedure, your womb is completely removed. It's an effective way of preventing fibroids from returning and is a definitive option to stop any further bleeding. However, you will only be offered this type of surgery if you do not want to have any more children. Radiofrequency ablation is a breakthrough alternative to myomectomy and hysterectomy. It's an incisionless, womb-preserving solution that is clinically proven to reduce fibroid symptoms, including heavy bleeding. All these options are available at the Clementine Churchill Hospital. There are other minimal invasive techniques that can reduce the size of fibroids, including uterine artery embolization. This is carried out by a radiologist and involves blocking the blood vessels that supply the fibroids, causing them to shrink, therefore reduce your symptoms. Again, not all types of fibroids are suitable for this procedure. We hope this video provides you with the information you need to understand treatment of uterine fibroids a little bit better. If you have any questions, feel free to leave them in the comment section below. If you would like to arrange a consultation with me or the nearest consultant in your area to discuss uterine fibroids even in more detail, you can book an appointment at circlehealthgroup.co.uk.